Palpation of heart. Before examination, as with any procedure, you must greet the patient, introduce yourself, take adequate consent, create comfortable condition, room should be warm and clean, then make sure wash your hands, put on gloves, and choose correct position, in our case in standing, upper body, undress it. Then perform examination. Firstly, you ask patient to tilt his body forward, left hand placed on the back position, then right hand in transverse size, place it on the heart region, base of the palm on the sternum, fingers direct to the intercostal spaces, 1st, 5th, 6th, and 7th, in this way. Then, after, you must give characteristic with 2 fingers, localization, width, height, strength, resistance of apical impulse. What means apical impulse? Apical impulse, it's limited rhythmic pulsation which locates in the region of the apex at the level of 5th intercostal space medially from mid-clavicular line 1.5 centimeters. Its localization. Apical impulse more than 2 centimeters wide is named diffuse or split and associated with left ventricular enlargement. Height of apical impulse. Its amplitude of oscillation of the chest region in the apex of the heart. Then strength. Strength of apical impulse depends from the contraction of left ventricle and thickness of the chest. Next one, resistance, which depends from functional state of myocardium. Next one, cardiac impulse. Firstly, we must put our palm in the region of the sternum 1 centimeter from the left side at the level of first intercostal space and determine. Cardiac impulse synchronous with apical impulse but more diffuse rhythmic pulsation. It's caused by pathological processes in right ventricle. Right ventricle will be enlarged. Then we observe it with hypertrophy and dilatation of right ventricle and normally don't observe it. Next one, epigastric pulsation. We place our palm in the region of xiphoid processus base and try and feel it. Normally, we can observe it in asthenic people. In pathological processes with hypertrophy and dilatation right ventricle and with aneurysm of abdominal wall, aortic abdominal wall. Next one, trembling of the chest. Trembling of the chest noted above apex of the heart during diastole with mitral stenosis. Then above aortic valve during systole with stenosis of aortic orifice. After, you must give conclusion for your investigation. Thank you.